Kathleen Keenan's life was all about fun and family. But those happier times were brought to an abrupt end by COVID.
It was the manner of it. It was somebody saying, your mum doesn't count.
Kathleen tested positive for the virus in hospital but was sent back to her care home in line with policy from the time.
You know, they were like fodder on the infantry line and, you know, just get rid of all of those because we're not saving them because we haven't got enough resources and time.
Kathleen was one of 12 patients with COVID discharged from Walsall Manor Hospital into care homes. A national push to free up beds started on March the 19th. On April the 2nd, care homes were told negative tests are not required prior to transfers or admissions. On April the 15th, it was updated, introducing a policy of testing all residents prior to admission to care homes. But how many were discharged untested or with COVID before the policy changed? Sky News has contacted all NHS acute trusts in England. From those who responded, 6,435 people were discharged into a care home between the 19th of March and the 15th of April. Of those, 4,210 weren't tested. That's 2/3 of discharged patients. And 623 of those who were tested had a positive result. During this period, the number of deaths in care homes was peaking. Conrad Chaika is a care provider in the Yorkshire area. He refused to take COVID patients from hospital.
It's a disastrous policy to bring people in to a nursing or residential setting when somebody's suffering with coronavirus, puts the safety of all the other residents at risk.
Campaigners who've lost loved ones to COVID say our findings are shocking. Charlie Williams's dad, Rex, died in a care home.
Patients flooded our care homes, and the result is thousands and thousands of our families dead across the country.
Walsall Healthcare NHS Trust offered condolences to Kathleen's family and told us there weren't bed capacity issues when Kathleen was discharged. They say the care home was happy for her to return. A Department of Health and Social Care spokesperson said, "We've been doing everything we can to ensure care home residents and staff are protected. At every stage, we've been guided by the latest scientific advice. Regular testing for staff and residents has now begun, starting with homes for over 65s and those with dementia." Kathleen's family believes the discharge policy cost lives.
I can't do anything for my mum now other than honour her memory and, you know, ask for an apology for what happened to her, because she deserved far better than she got. But I don't want any other family to be in the same situation as we are. We usually have it over there.
This corner of the garden reminds Helen of her mum and why she's fighting to ensure others don't suffer her loss. Laura Bundock, Sky News.